kizazi. Na kando na hivyo, ikiwa ni mama amezaa, amefanyiwa upasuaji ama amezaa inabidi aweze kulazwa katika hospitali, pia kuna hundi jingine ambayo kwamba inaweza kulipwa. Sivyo vile ilivyokuwa zamani, ya kwa ilikuwa ni kiwango kidogo. Sasa hivi pesa ambazo kwamba zinaingia kwa kila hospital ni ya juu zaidi. Na umetoa amri, Your Excellency, juzi katika mkutano wetu wa summit, ya kwa pia level 2 na level 3 ziendelee katika mambo ya uzazi. Ukaweka kauli yako, nimeona katika supplementary ya kwa imepitishwa, ili SHA iweze kusimamisha na kuweza kuyafanya yote haya. Your Excellency, sisi kwa niaba ya magavana wenzangu ni kutoa shukrani kwa serikali yako, na kama serikali za county tumezungumza na tutaweza kufanya bidii kupitisha leseni zozote ambazo kwamba zinahitajika, ili tuje kuweza kuzifungua hizi hospitali na tuwezi kujua pengine kutakuwa na watoto wanazaliwa pale, mmoja aitwe Ruto, mwingine aitwe Edha, mwingine aitwe Duale. Asanteni sana na Mwenyezi Mungu ajalie kila la heri. Asanteni.
Thank you, Governor. Your Excellency, with your permission, I'll now usher in the Cabinet Secretary for Health, Honorable Eden Duale, who will in turn invite His Excellency the President. Welcome, sir.
Your Excellency, the President of the Republic of Kenya, the Chairman and the entire leadership of Amson Group, our county governors, senior leadership of the Ministry of Health. Your Excellency, I will not say much because you'll speak for us as the Ministry of Health when we are in State House. But I just want to bring to the attention of this gathering that reduction of both maternal and newborn deaths in our country is at the top level of decision-making led by the President himself. And end of this month, end of next month, we will have a huge conference where we will equip, and the President will launch a set of equipments to all our county hospitals. And President will make a declaration that maternal and newborn mortality rate in our country must come to the level required by WHO. Your Excellency, I have also directed KEMSA through our governors to make sure at any given time our county hospitals will not miss the commodities that are required to save mothers from dying when they're delivering. I did it in writing. Secondly, Your Excellency, and you saw it when you were in Samburu, because blood is one of the causes of deaths of our mothers and children, we are building a number of satellite blood centers across the country, and we will brief you when you are going to open. And finally, we are talking to all our consultants and our healthcare workers that at the delivery room, the labor wards, they must do whatever it takes to make sure no mother and child dies because of human negligence. With those many, and we had a very good engagement with the Amson Group yesterday. We have agreed. Your Excellency, I want to confirm to you that on the part of MOH, we will deliver all the documentation within the next 3 weeks for these 10 sites. Beginning Monday, our team will be in all these fields. So if we finish, then you reduce the 90 days. Yes, so that at least the President can go and do the first groundbreaking in one of these counties. Yes, we will do. We don't want human bureaucracy to delay in saving the life of a mother and the life of a son. With those many remarks, dear distinguished delegates who are sitting here, can we please rise and welcome the President of the Republic of Kenya to make his remarks.
Thank you very much. Please, let's asanteni sana. Distinguished partners, friends, the Amsons group, and I'm very happy that the chairman, finally, of Amsons group has come to Kenya. Mr. Chairman, is it the first time you're coming to Kenya? Or you've been here before? I have been struggling to get this good man to come to Kenya for the last 1 year. But I think it had to take this mother and child for him to come, and it shows the significance of this event because we are discussing matters of life. And thank you very much for coming. Today marks another decisive step in our journey to secure better, safer outcomes for mothers and newborns across our country. The signing of the letter of intent for the health system strengthening initiatives with Amsons Group is a significant step towards closing critical gaps in maternal and newborn health, bringing urgency, clear purpose, and firm accountability to the task of safeguarding the lives of mothers and children. This initiative demonstrates the strength of partnership between the public sector led by government and the private sector led by Amsons this afternoon, to provide us the mechanism for working together to deliver scalable and sustainable solutions to matters to do with health. It is a shared responsibility to build, equip, staff, and sustain facilities for health delivery and to ensure that they deliver outcomes for mothers and children. Through this strategic partnership, we shall build 10 mother and child hospitals in all the regions that have been listed here across our nation, a deliberate and targeted investment to ensure that communities long left behind gain access to quality, affordable, and reliable health. When the Amsons Group stepped forward and they told me, Mr. President, we want to support your universal health program. We're a company that has a legacy of building or working with mothers and children. I thought their program was aligned to our universal health program. And when they mentioned to me that it is Mama na Mtoto Kwanza, I told them in our Kenya Kwanza manifesto, we are very much aligned because that is the reason why we have universal health as one of the primary pillars of our program that we sold to the people of Kenya. Amsons Group will facilitate the construction of 10 hospitals in the 9 counties in Kenya. They will provide close to 4.5 billion Kenya shillings, not as a loan, but as a grant. And when they approached me and said, we want to do this in a place of the choice of the government of Kenya. And I looked across the country, as Abdul Samad has said, and my primary target was areas and counties that we still have challenges of maternal and newborn deaths. I know I didn't cover all of them. We have a few more that are not here, but we will cover them under a different program that I am negotiating. I am very happy that we are going to have a hospital 2 hospitals in Nairobi, a hospital in Kwale, Kisumu, Huruma Hospital in Uasin Gishu, a hospital in Kabich Beach in West Pokot, a hospital in Mombasa, in Garissa, in Embu, and in Nakuru. And the governors who have come here to represent their colleagues will know that we did this because we wanted to look at where we have the most need. I know many other areas are needy as much, but we had to create a small priority. And I want to thank the Amsons group for trusting the Kenya government. They would have chosen to do this in their facilities. They would have chosen to do this to build a hospital in where they have their business. But they said, let's give the government of Kenya a chance to choose places where they have the most need. And I want to thank you, Mr. Chairman, and the Amson Group. So these good people will provide the resources to build the hospital, to put in beds and other facilities. The government of Kenya is going to provide land. We are going to provide the rest of the equipment, and we are going to provide the personnel to run the hospital. It is a godsend, let me use that. It's a godsend opportunity that we have Amsons investing in Kenya. Not many investors find the opportunity to do something as big as this. Many companies, they do token favors here and there, you know. Maybe give 100,000 here, small check, and they make a big ceremony. This, in my opinion, is a very modest ceremony for 4.5 billion. And I want to tell Amsons Group, on behalf of the people and government of Kenya, and on my own behalf, we appreciate your gesture of goodwill and support for our mothers and children. As somebody said earlier, we may not pay you in all manner of things, but God in heaven will pay you, because you didn't have to do this. It was not any responsibility. You have not asked for any tax waiver for you to be able to do this, but you have done this because, as Eda has said, you want to walk this journey with Kenyans, and you want us to walk together. Each hospital will have an antenatal section, maternal ICU, labor, delivery, and recovery sections, and 2 operating tables, among other equipment. This initiative, known as A Promise to Life, is grounded in a simple but profound principle that every mother deserves a safe delivery and every child deserves a healthy start. It aligns with the Mama na Mtoto Kwanza vision championed by Amsons Group, which places mothers and children at the center of healthcare delivery. In many parts of our country, long distances, limited infrastructure, health workforce shortages, and gaps in service delivery have placed lives at risk. Today, we are taking a decisive action to change this reality. But this initiative goes beyond infrastructure. It is about building a health system that is equitable, integrated, and responsive. To this end, the distribution of these facilities will be guided by need, ensuring that equity and access remain central to our development agenda. This program will be anchored within our universal health coverage framework, driven by a strong primary health approach, and we are building a system that begins at the community level and connects seamlessly to higher levels of care. We will have level 4 hospitals. This will strengthen secondary care at the county level, while a model level 5 will provide specialized services closer to our people, thereby reducing delays, improving outcomes, and of course, saving lives. Access to services will be supported through primary healthcare fund, ensuring affordability for our families. Our community health promoters will strengthen early detection, referral, and continuity of care, ensuring that services such as households are served effectively. This initiative also aligns with the continental and global commitments through the Every Woman, Every Newborn, Everywhere initiative. Kenya is contributing to the global effort to end preventable maternal and newborn deaths. We will accelerate this agenda through a rapid results initiative focused on delivering measurable reduction in mortality. This has been said ably by C.S. Duale. And taken together, the Every Woman, Every Newborn, Everywhere initiative, Kenya's Rapid Results Initiative, and Amsons, A Promise to Life program form a unified framework that aligns investment, policy, and service delivery towards one goal: saving lives. So, as Honorable Duale has said, we will be having a meeting this May to discuss and to agree that mothers and children in Kenya must never die when they are giving they are giving birth to life. You know, we really I think we have made a commitment that what is going on in Kenya today is unacceptable. There are still mothers who die, there are still children who die, not because they are sick, not because there is a problem, but because we do not have the right levers and instruments and facilities to ensure that they don't. So I will be convening a meeting with the governors from the counties that have the highest mortality rates, and we are going to agree on how we go forward together. I commend Amsons Group for your vision and confidence in Kenya. Your commitment to the Mama na Mtoto Kwanza approach aligns with our national priorities, and I assure you that we will work together to ensure this investment delivers meaningful impact for our citizens. And again, to Amsons, let me say I am truly, truly grateful that you have chosen Kenya to invest in Kenya. And your investment in Kenya is an investment of demonstration of confidence in our country. This investment in healthcare goes to the heart of your belief that you are in Kenya for the long haul and that we are going to walk this journey together. I must thank the county governors who found time to come and share with us this moment, because though health is a devolved function, we have worked together. And I must commend the Council of Governors, led by my good chair here of the Committee on Health, for their proactive role. Whenever we are discussing health, whenever we have initiatives, there is no challenge of tough, wars that you're overstepping. This is our mandate. You shouldn't be doing this. Our focus is not on what tough it is. Our focus is on the people of Kenya and the services that we must deliver to the people of Kenya, realizing that our constitutional imperative is that we must work together. And I want to commend the county governments for doing this. I have said also that as we go into the future, we are going to build additional resources into our primary health care fund. We're going to build more resources in our critical care and emergency fund, and we are going to expand coverage to make sure that we move together. We will continue to eliminate the challenges that are there, and we'll continue to work with partners like Amsons and others in expanding the footprint of facilities around Kenya. After this meeting, I will be discussing another facility that may give us another 14 hospitals like this, working with partners and friends from other parts of the world, because this is what will change our country. As has been said, health must never be a privilege for those who can afford, or those who have money, or those who have jobs. Health, as provided for in our Constitution, Section 43, is a right of every Kenyan. And it is our collective responsibility to make sure that every Kenyan realizes that right to health care without equivocation and without any limitation. So we will continue to work on this. I know that as we expand health and access to many Kenyans who have been locked out for a long time, there will be need for additional resources, which is a very positive challenge. You know, we are better off looking for more money to finance health than a system that locks out millions of Kenyans, you know, and serves just a few. Many Kenyans have been pushed into poverty because of medical bills. Many sell their properties, sell their livestock, and many things. But we have said as a government that we are going to do things differently, and we are going to bite the bullet and do the right thing so that every Kenyan can truly access health. So I'm very happy this afternoon to be part of this signing ceremony. I have been in many signing ceremonies, but this one is profound. Profound in the sense that we have friends and partners who have stepped forward with 4.5 billion Kenyan shillings to build for us 10 hospitals to look after our mothers and our children. It is first and foremost our responsibility. The fact that they are stepping in to assist us is consequential and significant and very important. And we don't take it for granted. And I say this with the understanding that we did not request. You stepped forward and told me, Mr. President, we want to assist. And thank you very much for coming through for the people of Kenya. To my good friends, the governors, now the journey begins on our side. Aden Duale, you have committed that 3 weeks we will have all the documentation done, visibility study, papers. I must disclose that I did sit down myself to work on the design. And then I suggested to Amsons, they went and adjusted, just to make sure that it is, I had a lot of input in the design, you know. I like to build things. So whenever I find somebody who is trying to build something, I really enjoy their company. So we are building everywhere. We are building here in State House. We are building affordable housing in every place. We are building markets. We are building hostels. We are building county aggregation industrial parks. We are building special economic zones. We are building roads. And we are building all manner of things. Now this is an occasion to build this hospital. And I'm very happy with the design. Thank you very much, Amsons, for not changing it too much. I really wanted it to be, but you have said it yourself, it's world class, and I agree that it is world class. So thank you very much. I'm very happy, Mzee, for you finding time to come and be part of this ceremony. It speaks to the importance you attach to this important ceremony about children and women. Business is good, and it's good to be an investor, but it's also to think about people, and people at that level. Some of the facilities you see here will be in areas, you know, when I told you, allow me to choose areas that are very deserving. You know, some of the hospitals are in very, you know, either areas that are, and when I talk to the governors, areas that are very needy, so that we can get the people who have been left behind for a while to join the rest of us. So asanteni sana, congratulations, and God bless you.